At least 2,000 children are born every year with clubfoot in South Africa, and if left untreated, a child will lead a life of disability. This is according to STEPS. It's an organisation that offers support to parents and caregivers in taking care of babies born with a clubfoot. The causes of this congenital birth condition are still unknown, and it is estimated that it affects 1 in 500 births. Now, this morning in our Health Matters segment, we take a closer look at what is clubfoot and the treatment involved. And joining us is Karen Moss. She's the founder of STEPS. Karen, thank you very much for joining us. It's good to have you here on the program.
Good morning, Leanne.
Let's start off with absolute pleasure. Let's start off with the basics. What is clubfoot?
Well, clubfoot is it's a condition that's present at birth, so it's congenital. It's as you said, the cause is not known, but physically what clubfoot is when the foot is either one or both feet are turned over and pointed inwards towards the body in a rigid position. With the foot in this position, if it's left untreated, the child will end up having to walk on the side or top of the feet and is unable to wear shoes, so it becomes a permanent disability. However, there is a way to treat clubfoot, and that's why we have these awareness campaigns, is to educate the public about the options that are out there to treat clubfoot effectively and therefore not have disability.
According to a couple of your numbers, you say that at least 2,000 children are born every year with clubfoot in South Africa. What steps should health workers take when a baby is suspected to have been born with clubfoot? How do they manage that?
Well, the best, it would be somebody who's obviously working in antenatal, maternity clinics and that type of thing. The most important thing is to get that child in for a referral so that they can be properly diagnosed. Sometimes it looks like a clubfoot, but it's not. If the foot's slightly turned in because of maybe not having enough space while the mother was pregnant, but you will always see the difference because it's not so rigid. However, there are referral channels. We are noticing that, having been involved in this for many years, those are improving. But health workers should know that they should always encourage the parents to go straight to an orthopedic facility, and preferably one of the specialist clinics. That there's 48 around the country that we are supporting in the state health sector, still not reaching everywhere. But the sooner a child is diagnosed and the earlier they become treatment, the quicker and simpler it is to treat. Mm-hmm. What is the problem is when it's not identified, and we then have children being picked up at 3-4 years old, and it's a much more complicated process, and it takes much longer and is obviously hard on the child. So I would say for health workers, if you would like to know any more information about clubfoot, we do have a one-pager, which is a lot of information about how to identify it and referral channels, and you're very welcome to either contact us or download it off our website.
Yeah, I'm reading some frightening statistics that you've supplied to us. It's basically saying South Africa's black population has the second highest rate of clubfoot incidence in the world, an estimated 1 in 500 live births. Perhaps elaborate a bit more on this.
Well, the world average, it varies between 1 in 750 and 1 in 800, but there have been studies done in South Africa, particularly when it's looking at our black population, that there is a high incidence. And it is known that there's certain areas of the world that either have a lower or higher incidence. For example, Japan is much lower, whereas parts of other countries may be higher even than us. But it has been identified in some studies. However, we're not really sure, because this is something that is still being identified with stats. There aren't enough stats being collected. We belong to a global umbrella organization called Global Clubfoot Initiative. It's got many members from all around countries in the LMIC and middle income countries, and we're starting to collect data, and it's actually becoming very interesting, because soon we will know within a few years what is the real incidence, but we've based that number on studies done in South Africa.
Yeah, and obviously when you for South Africans and for mothers or parents that are able to get scans, and this is really a privilege, because so many are not able to have scans through their entire pregnancy, and then you give birth, and as you say, sometimes it's too late because people don't look for the symptoms and they don't know what to look out for, and then of course it gets more and more complex to try and treat it. But you do pick it up in a scan, is that correct? And Is it something that from when you're a baby, or don't you pick it up in a scan?
Well, interestingly, my son was born with clubfoot,
Yeah.
and I had all the resources and had scans, and it wasn't picked up. I think that scans have probably improved a lot since those days because he's 22 now.
Yeah.
But it depends on the position of the baby. So you may not always pick it up in a scan, but you will certainly see it at birth. And I think, I don't know, I realize that not many people in this country have access to scans because of the cost of them. But even so, if it's identified at birth, that is still fine. Like my case, that's when it was identified. And we were told at the time, when my son was born, I was told that he had clubfoot.
Yeah.
It was identified and diagnosed immediately. Unfortunately, this is not always the case. Depending on where, I often say it's like a lottery, where your child is born determines how quickly and successfully they will be treated. And this is growing in more areas, but we still have a long way to go to reach every child that's born with clubfoot in South Africa.
So your son now, you're saying is 21, I think you said 21?
Yeah, 22.
22. Is he leading a perfectly normal life? Does he have any issues? Because it was sorted early.
What happened with him was when he was born, the option in South Africa was surgery for most kids, and there was no real. There were a few doctors trying minimally invasive and long-term casting, and then perhaps that they might get some results. But traditionally, if you had a rigid clubfoot, it was surgery. But I was lucky enough to find a method that had actually been around for 50 years, but had not really been adopted yet by the medical community, which was called the Ponseti method. My son was treated with that by Dr. Ponseti, completely non-invasive, one small procedure on the back of the heel under local anesthetic, and his feet were straight. So I obviously was completely, in awe of what had happened to my child and how simply it had happened. Although when I'm simplifying it, there's still a lot that parents have to do, because after that my son had to wear a corrective brace while he slept until he was almost 4 years old. So there is a lot of parent intervention. However, there isn't a long-term effect. So my son is doing extremely well. He has no pain in his feet. He's played sport. He goes to gym. He does whatever. In fact, he goes hiking. And it's really a great testament that this method can be successful for so many children. And studies worldwide are showing 90 to 95% success if it's done correctly.
That's incredible, the Ponseti method, but that obviously is not available all around, and particularly in rural areas where you find it's just too late, it's diagnosed too late, and then, to try and fix that up is a problem. And I imagine there's a lot of misconceptions and myths around clubfoot as well.
Yes, you've covered a lot of the things that we focus on, actually, and that is to try and decentralize the treatment. So when we first started our clubfoot care support program in 2013, and then really started establishing it around 2015, so 10 years ago, we had 6 partner clinics in the state. We've now got 48. And we made a decision a few years ago, I think it was in 2017, to start focusing on rural clinics. But what is interesting about the Ponseti method is it initially was only done by orthopedic surgeons. And out of Africa stemmed this innovation where some parts of the treatment could be done by affiliated health workers such as physiotherapists, which then reduce the cost and also increase the access, because there's many more of those types of health workers living in rural areas, and they're incredibly skilled and passionate. So what we did was we focused on not only supporting the larger clinics like Chris Hani Baragwanath, but also looking at a tiny clinic, say in rural Eastern Cape, where it's run by one physio and an occupational therapist, and supporting them so that kids who live near there can actually have access to treatment. And that has been, as I said, it's grown. It still hasn't grown completely, but one of our great barriers is costs for travel. And that is one of the reasons why some children, we may know more about clubfoot, doctors know how to treat it, but how do the children get to the hospitals, and are they well equipped? And also advocacy. As you said, there is stigma still around it. I would say more in the areas which are more rural and outside main centres. And it's trying to get the message across to communities that clubfoot is not a curse. It's not something the mother did. Nothing anybody did caused clubfoot. It's just a genetic thing that happens, and that children and their families should not be ostracized or blamed or shamed. And it's a really important message to get out there, so that this is sometimes what stops children from getting treatment, is they're hidden away.
Yeah, amazing. Really interesting conversation, Karen. Just give me your details for STEP if people want to get hold of you, if they need more information or assistance.
Yes, well, the easiest way is to just go to our website, which is www.steps,
Okay.
or call us on 021 462 7357. I think, it's so, I was listening to your question of the day, and it's so important for these kind of initiatives, for the public to actually get involved, to know about it, because we need to take these kind of things, responsibility for them as well, and to share the information and even support organizations that are doing this kind of work, because
Absolutely.
I've noticed on the ground that there are so many incredibly passionate health professionals, but there are limited resources and a lot of struggles. And the more help that they get, the better children can access care.
All right, Karen, thank you. Thanks so much for talking to us. Karen Musk talking to us about the prevalence, and higher than I ever imagined, around clubfoot and awareness around clubfoot. It's a birth defect that affects more than 2,000 babies every single year. But basically, I mean, the big stats, just talking about them, 1 in 500 children, black children in South Africa, get affected by this. So this is a very big thing, and awareness around it. www.steps.org.za. That's where you can visit the site.